So, like low right side pain. I mean, I could have swore like I was having appendicitis one time. I mean, it was such severe pain on my low right. I thought, okay, I'm going to die. It's appendicitis. Luckily, no, it was probably just my ileocecal valve because after I did some stool testing, I had some bacterial overgrowth problems. I also had some parasites at that time. So, maybe we should talk about that kind of the infection connection here. We talked about H. pylori up at the top, but
Yes.
infections could also be, I mean, really anywhere, but we're trying to be specific. But the low right area, that to me is like a parasite area as well.
Yeah, ileocecal valve's a big one because that's where the small intestine meets the colon. So you have duodenum, jejunum, ileum. Those are your three parts of your small intestine. Duodenum's the top, jejunum's the middle, ileum's the bottom, and then the ileum then goes to the colon on the right side, and that's the ileocecal valve, right? So it's cecum on the colon, then it goes up to a ascending, transverse, descending, and then sigmoid comes down and deep in the middle. Now, in the middle, at the very bottom, this is where it could be a prostate issue too. It could be a bladder issue as well. It could be a deeper ovarian cyst, endometriosis issue as you know, if you're a female. So you got to keep those different things in there. And of course, like Evan was alluding to, is anytime you have a parasite infection, these things can emanate in different parts of the intestinal tract and create inflammation. And there's no kind of, hey, this is the area where parasites go. They kind of have free reign. So just keep that in the back of your head. A parasite issue could create pain in any of these areas, and it's totally up for grabs.
Yeah, we do know that Giardia can affect the gallbladder. So I would just say, as a general rule, if you're looking down on your right side, so under that rib cage on the right side, working down towards the appendix, that's where I had pain and I had Giardia. So if you have infections, if you've had bad water, bad food, or you just most of your pain's localized to the right, I'm not going to say 100% because that's not what this podcast is for, but that would say, hey, that's enough symptoms for you to justify getting some functional testing done, potentially an ultrasound as well. But in some cases, you may just need a really, really good DNA-based stool test. We can look at these infections, come up with a protocol to address them, and dialing in the diet, and then that pain magically might just go away.
100%. Yeah. Always good to keep an eye on all those things. And that's why it's good that you work with a good functional medicine doctor, because food allergies can cause a lot of these problems too. You're going to see more food allergies kind of emanate in the upper to middle quadrant areas, but sometimes you can see it lower quadrant. I had a patient
when you say
with
food allergies, we're talking what?
gluten sensitivity, inflammation from gluten, inflammation from foods, but the most common ones are going to be grains, of course. And then you can see even dairy create problems. And then you have more of the autoimmune food allergens, which are going to be eggs and nuts and seeds, and those can create problems too. And you're going to see them more in the upper and middle quadrants, but sometimes they can work their way down to the colon as well. It's possible. I've seen it. And like you mentioned, different parasites can work their way down there too. And typically just having bad digestion, you start to see that in the middle to upper quadrants, because usually it starts with poor hydrochloric acid.
And the
Usually if
nightshades
someone,
too, tomatoes, peppers.
yeah,
Those
tomatoes, peppers, yeah, all those can have a problem. With digestion, you tend to see the first domino tends to not fall correctly. And that first domino is not enough acidity and then not enough enzymes starting in the gastric tummy area and into the upper small intestine. So you start to see it here. It's very rare to have good digestion starting off and then it goes bad downhill. It tends to be, hey, we start the domino rally correctly and then all the other dominoes kind of fall in place, so to speak.
That's a good point. Yeah. So just to say it another way, the dysfunction will probably be evident at the very most north starting place. It's not, you're not likely to have just a, southern gut issue. It's probably going to start up here, and then down there you may have problems as well at the same time.
Where you see more southern gut issues, it typically is going to be like a diverticulitis thing.
Okay.
A lot of times could be a parasite, could be an appendicitis thing. I've seen it happen, but just kind of a generalized rule of thumb of what I see on average.
All right. Here's one thing that we forgot to mention, because there's probably a couple moms screaming at us saying, "Oh my God, you're not talking about diastasis recti."
That's
if you've had babies, yes, you could have some scar tissue up in there. Justin's somebody who educated me all about myofascial issues, and so there could be some myofascial / scar tissue in that area as well.
Yeah, it's all about history. So if someone's just had a baby, that's different. Some of the, the more cutting edge surgeons, they'll even put a couple of sutures and when they're taking the baby out afterwards, or if it's a C-section, if they're going in for a C-section and they're already in there, they'll put a couple of sutures in that midline just to kind of keep that muscle together a little bit so it doesn't separate. Basically, imagine the six pack, so to speak, the midline of the six pack kind of separates, and you can have a little bit of bulging there. And that's almost always going to have a pregnancy history with it for the most part.
I didn't have any babies, but I had that pain because I got.
Yeah, but you didn't have the full separation where there was a bulging out.
No, I never had any bulging, but I just had a lot of midline pain that I thought could be related to hernia. But after I got an abdominal ultrasound, they said that I did tear the abdominal wall. And it's because I was using improper form. I was lifting super heavy kettlebells, like 90-pound kettlebells. I was lifting those out of a crate to pack those up when I was working down in Texas. Just dumb, lifting heavy stuff, improper form. And I really did a number 2 to that abdominal wall.
Yeah, exactly. And then for someone like for you, you're working on with a good myofascial release or an active release person, kind of breaking down that scar tissue. And then, then you're working on better form with good abdominal bracing to activate that TVA kind of ahead of time. So that's good.
Yeah. So heavy lifting, people listening, if you're into CrossFit or whatever else, you're lifting heavy rocks or crazy stuff, make sure that you're doing it with proper form. Cause I'll tell you, after having an abdominal wall injury, it really limits what you can do. You don't realize how much you use your abdominals until you injure them.
100%. Anything else you want to highlight so far in regards to the abdominal area so far?
I think you did good mentioning the bladder stuff. You mentioned the ovarian cyst as a possibility. What about fibroids too? Wouldn't that also be kind of same area?
Yeah. So we have endometriosis is going to be basically endometrial tissue growth outside of the uterus. So you're going to see that could be on the outside of the uterus wall. It could be, or the outside of the uterus. It could be on the bladder area. It could hit some of the intestinal area. So that could hit in some of that lower quadrant, and you're going to see that more flare up around premenstrual and menstruation time. So you're going to see a timing there. And obviously that's going to happen with women only. And then fibroids as well. That's going to be more in the uterine area. So that's going to be right in that pubic bone area, midline, because the fibroids can contract a little bit. And if they're intramural fibroids, meaning there's kind of sandwich in between the muscle, then you feel it a little bit more. If they're subserosal, it's in the uterus. If they're a peduncular, they're going to be at the top. If they're, there's one more kind where they're on the outside. I think it's it's on the outside. So you'll just feel it a little bit more lateral, so to speak.
Okay.
And you'll see it happen, more around premenstrual, leading up to bleeding to during bleeding.
Okay. That's important. A lot of women listeners. So the inguinal hernia, yes, like I said, when I thought I had a hernia, that was the area. They said, yep, you could definitely have a hernia around here, but luckily I didn't. But it's super common. So, tons of people are getting those mesh surgeries, and then they're having tons of complications from those. So I'm not an expert at hernias or surgeries, but my limited knowledge of it says to do the mesh free. If you're in the situation of a hernia in that area, a mesh free surgery sounds like there's less complications as doing the mesh. Yeah.
And with the fibroids, it's the submucosal is at that mucus lining inside the uterus. The subserosal is more superficial, more on the outside, just for any of the clinicians listening.
Sweet.
All right, cool. So we hit all the female stuff. Of course, ovarian cyst could be a big one. That'll be a little bit more lateral. All right. A little bit more outside. It'll be more right where the ovaries are. So ovaries are going to be a little bit lateral to the uterus. And that same thing will be timed up more on premenstrual and or menstrual. And you're going to only ovulate from one ovary. So it's typically going to be bilateral. It's going to be typically unilateral, one side over the other. It won't be both sides at the same time.
That's a good point. Good key distinction.